Hi, my name is Jack Bonnywell. I'm a physical therapy student here at Rocky Mountain University. The plan for today is we are going to get some cervical mechanical traction set up for a patient. His name is Jack as well. He's a 42-year-old and he came into the clinic with pretty excruciating kind of left upper neck pain. About a week ago, he was lifting some heavy rocks in his backyard and eventually left him with some extreme pain over the area. After we checked range of motion, kind of strength in the area and in the distal arm, we came to a conclusion that he could have or is likely to have a C5, C6 disc herniation. So we are going to set up the cervical traction with him to try to decrease his pain, maybe get some strength gain back, and overall just try to help him feel a little better after what he did to his neck last week. With that being said, there's a couple things that you should watch out for when doing mechanical traction. So if there's any chronic pain, any MSK issues at the site of traction, these are kind of contraindications. A couple times when you never want to do mechanical traction is if there's any acute cervical trauma, osteoporosis, any rheumatological disorders, joint hypermobility, pregnancy, spinal implants, and then non-mechanical pain, previous use of steroids. Some good times when to use mechanical traction is when there's just generalized cervical lumbar spine pain. With that being said, we will move to the patient and I will show you how to get this system set up. Awesome, so we're here with our patient Jack. How are you doing today?
Doing all right. My neck's really bugging today.
Okay, well, hopefully what we're going to do today is going to help it feel a little bit better. The plan is we're going to get you set up on this traction machine. So essentially it's going to lift that head up and try to kind of separate and make some space in that neck to try to decompress some nerves, and hopefully kind of decrease that pain and increase that strength for you, since we are getting symptoms gravitating down that left arm of yours. Shouldn't experience any pain or discomfort, more than relief of anything. Are you wanting to try out some traction today?
Yeah, I am down.
Okay, so we are going to get Jack set up and I'll kind of walk you through that process. So we're going to have Jack lay down. We adjusted the device so there's a little more flexion in the neck since we are trying to isolate that C5, C6 spot. How are you feeling right now, Jack?
Pretty good.
Okay, so once we have the patient laying down, we are going to tighten the side guards. And what we're looking for here, Jack, is just kind of a snug fit kind of behind that head, kind of just below your skull. And you just let me know when you feel that, okay?
Sure.
Right about there?
Yeah, that's
perfect. So what we're going to have you do is, here's the pump. I'm going to put it on pump. You're going to look at that, and you're just going to slowly pump until you're about 15 to 20 pounds on there, okay? And we're just going to hang out for about 10 to 20 minutes and see how it treats you, okay? At any time, if it does start bugging you, I'm going to leave a bell here next to you so you can ring the bell. If you look on the side here, there's also a release mechanism. So if you are having any pain or discomfort, just twist it to release and it'll slowly let that pressure out for you, okay? With that being said, let's go ahead and see you pump that thing up to kind of the desired pressure. And just above 10. Perfect. How are you feeling?
Feels good.
Good. So like I said, all I want you to do is kind of relax in this position for the next 15 to 20 minutes, and we'll come back and kind of see how you're feeling, okay? And again, there's a bell next to you, so if you need my attention or anything, just ring the bell and I'll be right over, okay? Awesome. Right. See you in 10 to 20. Awesome. So it's been about 15 minutes here with Jack. We're just finishing up the treatment. How is everything feeling?
Yeah, neck feels a lot better.
Awesome. So what we're going to do is we're just going to get you disconnected from this mechanical machine. have you sit up and we'll kind of check that range of motion and strength again to see how you're feeling and see how it improves some of those symptoms, okay? Awesome. And that's how you set up some mechanical traction for a patient.